Hello. In the midst of this storm, we've tried to bring you timely and relevant information about our local efforts to support residents and small businesses, to share good news in the community, and to help you access assistance and to bring experts into the conversation whenever needed. And while a lot of our videos have featured positive, uplifting news in the community, sometimes it's also important to help raise awareness on very tough issues. You may have heard that in times like these, where physical distancing restrictions largely sequester people into the confines of their homes, communities across America have seen an uptick in domestic violence. Unfortunately, we've seen that trend here in Gresham as well. I asked the Gresham Police Department to pull up the data on our domestic violence calls, and it tells an alarming story. Last year, between March 12th and March 23rd, there were 12 domestic violence calls in the city of Gresham. In the same time frame this year, we had 19 calls for service. That's a 58% year-to-year increase. And in the month of April, through last Tuesday, we had 15 domestic violence calls to the police department, a 50% increase over the same time frame a year ago. That paints a very concerning trend. We all know that Gresham is a very tightly knit community and we all watch out for each other. And to best equip us to disrupt this trend, I thought it would be helpful to bring in a national expert today who can help us understand the factors contributing to the increase in domestic violence and to provide advice for how best to disrupt it. We're very fortunate today to be joined by Ruth Glenn, who is the president and CEO of the National Coalition Against Domestic Violence. Ruth, I just mentioned that domestic violence calls are certainly up in Gresham. Is that true for other cities across the country? What are you seeing across the nation right now?
We are seeing an increase, but it really varies. For instance, we have one community that is reporting a 6% increase. I spoke with another community that is seeing a 200% increase. That was yesterday. I think it matters on so many levels and the variables of what type of community and all of those types of things. I will tell you that we absolutely expect another spike once we're through the COVID stay-at-home and shelter-in-place orders.
What are some of the risk factors or circumstances that have been brought on, particularly by this pandemic, that have, you think, caused an increase in calls and abuse?
I think proximity to the victim. I think the victim not being comfortable that she can reach out. So victims already have a certain amount of when they feel safe enough to reach out, right?
Right.
Victims get to make their own determination about that because we don't certainly want them to be at further risk because they've gotten out. But imagine that you finally decided to reach out and now you're fearful of COVID or any of those types of issues. I think the other thing is really the proximity of an abuser to the victim. The victim may have had some respite or other means by which to be away from the abuser. That proximity, not only will we see an increase of reported domestic violence, but I'm encouraging people to think about the intensity that victims might be enduring right now.
Right. What advice do you have for people that find themselves in this situation right now where they may be experiencing domestic violence? What advice would you have for folks that may be facing that?
If they have decided that it is time for them to do something different, please don't hesitate to reach out. If you have a family or friend that you trust, if you feel like you need to call law enforcement, if you feel like you know where your local domestic violence program is, do not be afraid to reach out. Domestic violence programs and law enforcement, especially domestic violence programs, are doing all that they can across the nation to ensure that COVID hasn't impacted their level of service. And it's been challenging. If I were to say it wasn't, that wouldn't be true. But domestic violence programs are saying and reminding us, please do not discourage the victims when they've decided it's time to reach out. Most victims already have a safety plan in mind, right?
Mm-hmm.
They don't know that they have, but up here they've decided, I'm going to let a family friend know, I'm going to let a neighbor know, whatever it might be. Stick with your safety plan. And you can still get determined when, but don't hesitate to reach out when you've decided it's time.
Mm-hmm. And one of the things about this with this pandemic is everybody is at home and we're not getting together. And so some of those friends that may have reported something or helped somebody, they're not accessing those people right now or available to do that. So is there any sort of warning signs that friends and neighbors and families should be looking out for? And if there are, what are those?
Particularly in COVID, I think further isolation would certainly be a warning sign. I used to hear from Ruth at least once a day because we were checking in about the madness of COVID, and all of a sudden I don't hear anymore. Um, I used to be able to meet her at the park, and with our social distancing, we would take that 15-minute walk. Where is she? When I call now, somebody else is answering the phone, and she's not answering the phone. And I use she because we know that 85% of all victims are women, right? But all of those things, if they give you cause for pause,
Yeah.
pay attention
Yeah.
and do that extra reach out that says, "Are you sure you're okay? I haven't heard from you. And if there's anything going on that I can help you with, let me know."
Yeah, excellent points. Often domestic violence is hidden from plain view, as we spoke about. What else should we know about domestic violence?
You know, Mayor, I think we go back to the gut check, right? That if I'm a family friend or acquaintance, and I feel like there is something going on, and it can be in a grocery store. Before COVID, I used to talk a lot about domestic violence isn't just in the home, and our communities suffer. I mean, we hear stories of an abuser showing up at the workplace and all those kinds of things. Well, it's a little different now, temporarily.
Right.
So just pay attention to your gut. And what I advise those that would like to help is not to tell the victim to leave, but to say, when you need to talk about this or when you need to take action or whatever it might be, I know what's going on for you. I have the hotline number. I won't give it to you, but I have it if you need it. I know how to reach the local domestic violence program. I know of some resources. You can stay in my basement, whatever those things are. So don't hesitate to say, "I want you to know I'm here for you when you're ready."
Yeah. Well, I think that's really sound advice and some great tips and pointers for not only the general community, but also folks that may be experiencing domestic violence. So I really appreciate you being with us today, Ruth, and thank you for your national leadership. We certainly appreciate it.
Thank you so much, Mayor, and I will talk to you tomorrow.
Sounds good. Thanks so much, Ruth.
Take
Bye-bye.
care.
Okay. Ruth, thank you again for your time today. We greatly appreciate the information and the advice that you shared, and even more so, we greatly appreciate your tireless national advocacy on this critical issue. Nearly every American knows somebody who has been impacted by domestic violence. There are between 1 and 3 million reported domestic violence cases in the United States each year, and a tragically high number of cases that never actually get reported at all. If you are experiencing domestic violence, or you know somebody who is, please access the resources that will be listed on your screen in just a moment. Your community stands with you, and we're here to help. Thanks, as always, for being the very best neighbors that there are. And as always, I pray for your health and your safety. God bless.